Policy and procedures. To ensure open communication, coordination of care, and consistency, the following policies and procedures are set in place. Number one, our patients are our top priority. All progress notes and visits performed Monday through Sunday are due in the office the following Tuesday by 5 p.m. Any progress notes received after the deadline will be considered late. Late progress notes will not be compensated for on the current or scheduled payday. Late progress notes will be compensated for on the next payday following the original payday for that pay period. Any progress notes received after Friday of the same week will be labeled as non-billable and returned to you for non-payment. Initial evaluations and treatment visits are to be conducted as timely as possible. Current regulations state within 48 hours of a therapy referral. If unable to meet this requirement, you must send a communication or call us immediately. Initial evaluation and treatments are to be faxed within 48 hours of completion to ensure continuation of care. Evaluation paperwork and progress note paperwork should be clear and concise as possible to avoid miscommunication of treatment plan. The originals are to be mailed in each Monday for proper billing and payroll. Missed visit forms are required each week the patient does not receive treatment as set forth by the original frequency. Communication forms are required for all events or circumstances to ensure written record of all incidents. Weekly payroll sheets are to be filled out completely and turned in with paperwork to ensure proper payment. Do not write or pencil in the name of a patient onto your timesheet. If the patient is not on your timesheet, this means the patient is not to be seen. If you disregard, and you do, you will not be compensated. We do not authorize any independent contractors to make changes of any kind to their timesheets. If a patient is added to your roster during the week, you will receive an updated timesheet with the additional patient added to the schedule. This updated schedule will serve as your new weekly schedule and is to be submitted along with your progress notes. Patient logs are available in the patient's home and are to be signed at each visit to record visits made. No exceptions to this rule. Vital signs are to be taken and recorded at each visit. Please contact us and we will contact if the patient's vital signs are outside of the normal range. The time in and time out should be no less than an hour per treatment. Current and updated credentials are to be signed, are required on file in our office before payment for services is received, i.e. copy of your driver's license, social security card, physical therapy assistant, physical therapy or aid license. Check the payroll chart for an explanation of when payments will be issued. The payroll chart will also indicate which pay periods are being paid for. Please understand that APSHMR staffing issues payment based on every 2 weeks. In translations, this means that your first paycheck will not be issued for 4 weeks. It is your responsibility to ensure that you have enough finances to endure until the first paycheck is received. APSHMR staffing does not issue payroll advances. Understand that at no time are you to contact any vendors, i.e. the home health care agency contracted to the company. Violation of this policy will result in immediate termination of employment and you will be subject to criminal prosecution. If you have outstanding or past due progress notes on your payday, your paycheck will be withheld until outstanding or past due progress notes are submitted. You must fill out the progress note in its entirety. Incomplete progress notes will be returned to you until they are completed. Please fill in the time in, time out section, patient signature section, blood pressure, pulse, and respiration section, and the course of subjective, objective plan. Please refer to the templates on your progress notes included in the packet. If you have you have 2 choices in this packet. These forms are included in your independent contractor packet. Patient abandonment will not be tolerated. When you accept the patient, it is your responsibility as a healthcare professional to continue to provide care until the end of the certification patient period for each patient. Please answer the questionnaire that is attached to this policy and procedure statement. After completing the questionnaire, fax it into the office. If you do not score 100, you will be required to take the examination again.